How to simplify your Class 4 composite restorations. 5 easy step protocol. We want to thank Colteen and Olar Art for sponsoring our case review series, which is part of our YouTube channel series. As you know, we have over 100 videos that you can choose from and watch their content for free. We're always hoping that all of our videos help you in one way or another to increase your productivity and your outcomes, to improve your outcomes also in your clinical daily practice. We also want to remind all our followers that in April of this year, actually Friday, April 26th or Saturday, April 27th, we will have our first hands-on course of the year. This will be the Imperceptible Aesthetic Restoration, a direct composite hands-on experience. You will gain 9 CE credits for attending this course, 3 of which are lecture credits and 6 of them will be participation credits. So please make sure to visit our webpage, www.romerodentalseminars.com, and click on the Buy Now button so that you can save your spot. There's only 15 spots per day, and there's only limited spots still available. So please again, visit our webpage, romerodentalseminars.com, and make sure that you register for our upcoming course. We also want to have you, subscribe to our YouTube channel, and please, please, please make sure that you share with colleagues and friends our YouTube channel so that they can also benefit from all the information that you can find in this site. So let's get started with the topic that brings us together. We're going to talk about, how can we, Class 4 restorations in my practice are almost an everyday thing. Patients that come in either with poor, previously restored either Class 4 or composite veneers, or they come with fractured existing composites or fractured teeth. And I'm sure that you see these cases every single day in your practice as well. So how can I, or what can I share with you from a clinical review case or from a clinical tip standpoint? What can I share with you that may help you improve the outcome or and simplify the technique that you are currently using in your practice when it comes to Class 4 restorations? So the first step, or the first tip that I want to share with you, is what I call the bevel. And we are taught in dental school the importance of a bevel for any anterior composite restoration. I have seen videos out there in YouTube channels where many of the dentists recommend either a 1 to 1.5 wide aesthetic bevel on the facial aspect of any anterior tooth prior to you bonding a composite restoration to this tooth. And I normally go just a little bit further out than that. I don't recommend just a 1 to 1.5 millimeter bevel. I recommend what has been mentioned in the literature as an infinite bevel, which means that you want to cover 2 to 3 millimeters of that of the facial aspect of this tooth. And for a good example here, you're seeing tooth number 8, which had a fractured composite veneer. I'm sorry, fractured Class 4 restoration. And this Class 4 restoration had been in place for like 7 years. It had been chipped for the last year, and the patient just didn't find it the time to go to the office and had it repaired. So he came to my practice with this old restoration that had been fractured. And the first thing that I did is just remove that old or existing restoration using a combination of a fine diamond and some coarse disc, just to go ahead and remove all the remaining or existing restorative material. But at this point, I also roughened the enamel with that diamond burr, and I like using the 8888 fine diamond burr made by Comet. This burr has a red stripe, so it has medium grit diamond. It has a flame shape, and what I like about it is that you can very easily use this burr on the facial aspect of the tooth. And you can see here that I've kind of literally concentrated in the incisal third and almost the beginning of the middle third of the tooth. So I've really extended my bevel, beyond the fracture area. I've extended my bevel 2 to 3 millimeters beyond that area because, again, not only that I want to get different thicknesses and I want to make sure that line, transition line between the composite and the tooth become literally invisible. But I also want to take advantage of that enamel to increase my bonding surface. If you look at these restorations, many of you would agree with me that these are very difficult restorations because normally they're not that big in size. And if you just concentrate on trying to restore that couple of millimeters of missing tooth structure, you're going to have, chipping of this restoration continuously. So what I like doing is I not only that I like to give it a little bit of width from the buccal to the lingual, at least 1 millimeter width at the incisal edge, but most importantly, I like to extend this infinite bevel so that I can get a lot more of that healthy, beautiful enamel and incorporate it in my bonding protocol. So again, that first tip, make sure that you design a good bevel. This bevel, you don't want it to be 1 to 1.5 millimeters. I would recommend increasing the width of that bevel. And in this case, we've gone 3 to 4 millimeters. And again, it just increases the surface area for the etching. And at the same time, it really makes that composite disappear because you're starting from a very thin layer, thickening the layer towards the incisal edge. And once I do that with the 8888, as you can see, then I use either a coarse or a medium coarse diamond. I'm sorry, coarse medium or medium coarse um, finishing disc, and I go ahead and polish my bevel. So this is very important. You want to polish the bevel so that you end up with this smooth, beautiful, smooth surface. And again, the idea is just to make this bevel infinite and make it completely disappear. If your eyes don't know where it is, your eyes will not be looking for that bevel. And this is how you make that aesthetic bevel. You transform it into an infinite bevel after you polish it with either a medium grit, a medium, or a coarse finishing disc. My tip number two will be in relationship to the etching time. And again, why would we consider anything with the etching time? Well, once you have this tooth and the patient, the tooth has been isolated with the rubber dam, you can see that I'm placing a mylar strip to protect the neighboring teeth from the acid. But what is the tip that I want to share with you here? Again, because my bevel is an infinite bevel, you can see that I've gone beyond that infinite bevel with my acid etching. And one thing that you want to consider is that the areas of the tooth that have not been touched with a burr, so you haven't roughened that area with the burr, and then you went back and polished it with the disc, those areas that were not affected or touched by the burr, you want to increase the etching time. So normally for a case like this, once I do my infinite bevel, meaning that I use my 8888 and then I polish with the coarse or a medium grit disc, next thing that I do is I go ahead and acid etch, and that acid etching for me is going to be between 15 to 20 seconds. And again, I extend my etching, I go beyond my infinite bevel. I want to make sure that I'm going to hybridize that area. I'm going to place my adhesive right on top of that, all that area that I've etched. Again, with the idea of extending that bevel or extending my composite to that enamel. And I want to make sure that when I polish, I don't leave any of the composite bonded to enamel that wasn't etched properly. So if you're going to do an infinite bevel, 2 to 3 millimeters, like the one that I'm sharing here with you, you always want to over etch the area as you are seeing in this photo. Once the etching time goes between 15 and 20 seconds, please go ahead and rinse thoroughly for at least 30 to 40 seconds, and then bone dry. There is no dent and expose here, so all you're going to be doing is just bone drying, making sure that you have that frosty aspect of the enamel. If you want to re-wet your enamel for whatever reason based on your adhesive system that you're using, that's okay. For me, I use a 2-bottle adhesive system, and that's exactly what I want to share with you right now, which is that third tip or that third step in my protocol that I want to share with you that may help you improve or obtain better results with your class 4 restorations, which is the bonding step. And when it comes down to bonding, one of the things that I like to mention is or ask is what kind of bonding systems you're using. Are you using a simplified one-step type of bonding system? And if the answer to that question is yes, I want to tell you that I love using still 2-bottle adhesive systems. I'm actually, for this particular case, I was using OptiBond Extra Universal from Kerr. And the reason why I like this specific bonding system is because you have the primer and the adhesive in two separate bottles, so you only use this chemistry when needed, and it's actually mixed directly into the patient's mouth. If I had had any dentin exposed for this particular case, I would have primed that dentin initially, and then that would have been followed with the bond with the adhesive layer. But because I don't have any dentin exposed, all I need for this case is the adhesive layer. This enamel that has been prepared with that phosphoric acid is going to receive very well this adhesive layer, and that's what you're seeing here. I've just applied one or two coats of the adhesive, that second bottle, meaning that I don't have any phosphoric ester, I don't have any alcohol or acetone or any type of solvent in that bottle, in that second bottle, because that is only mixed with the primer in the case of OptiBond Extra Universal. On the second bottle is only the hydrophobic resin, and that's literally what I need, a hydrophobic resin that is going to impregnate that edge enamel surface, which has very little to no water content. So this is critical. You don't have any water to remove. You don't have like you would have in dentin, so there is no need for any primer. When you have a simplified system, you have all that chemistry mixed in a single bottle. You can't separate this chemistry. So again, because of that reason, I still like using two bottle systems, and that's exclusively what I use in my practice. And for this particular case, I only needed that second bottle for the adhesive step that I apply into the enamel. You can see that I've extended beyond. I mean, I don't even know where my bevel is anymore, because again, that bevel was polished. It's an infinite bevel, but you can see that I've extended all the way through the area that I was able to etch with that phosphoric acid. And now we go to the fourth step, which is a critical step. Now you have your adhesive layer, you're ready to restore this tooth. How do you start restoring? How do you go about restoring this tooth? For this particular case, and for many cases that I do every day in my practice, I normally do this free-handed. Can you get an impression? Can you do either a digital wax up or an analog wax up, and try to make then a lingual matrix impression, a lingual impression, so that you can create a lingual matrix? Can you use a lingual matrix to simplify your procedures? Yes, the answer to that question is yes. You can definitely do that. But how many times do you in your practice, have a patient that shows up with a fractured tooth, like the case that I'm sharing with you today, or even a larger fracture, and they want to leave that same day with the restored tooth? So if that is the case, you're going to have to come up with a way, with a simplified protocol on how to develop these teeth without using a lingual matrix. And for this, what I normally do is I use a mylar strip. I put my finger on the lingual aspect of the tooth. In this particular case, I was lucky enough that it was a small restoration, but you can watch other videos of mine here on my YouTube channel. I share with you much complex, more complex cases where I have to build either half of the tooth, so much larger restorations that I still use exactly the same technique. And just, an easy way to explain this technique for you is just simply using a mylar strip and making sure that you put even pressure on the lingual side of the tooth. If the fracture is beyond the middle third of the tooth, you want to make sure that that pressure is placed on the remaining tooth structure. So on the area, on the more gingival aspect of the tooth. In this particular case, again, I had a lot of tooth structure available, so my finger is placed in a way that it keeps that mylar strip flat against the tooth. I normally have my dental assistant apply the curing light so that I can hold and I can keep that mylar strip with the right shape and anatomy throughout the whole procedure. And once I get that done, once I know exactly how my finger is going to fit underneath that tooth, I let go of my finger. I just release a little bit of the pressure. I inject the first layer only on the lingual aspect. In this particular case, I'm using Brilliant Everglow from Colteen, and I'm going to inject that Brilliant Everglow. A2B2 is a shade that I decided to use here. It's a dentin shade. I injected it in between the mylar and the tooth. And once I inject, then again, I put pressure on that mylar. I do that so that the composite spreads out on the lingual surface of the tooth, and I get some bonding to a little bit of that enamel that I have on the lingual. Even though my infinite bevel is only on the facial, you still want to have at least half of a millimeter to 1 millimeter bevel on the lingual, again, to increase the surface, the surface where you have those micropores that have been created by the acid, and then you're going to be able to bond some of that composite to that area. So again, I inject that layer, that first layer of composite, a very thin layer. I put some pressure on the lingual of the tooth again, make sure that my molar is flat, that is not U-shaped, that is nice and flat, so that the anatomy of that lingual layer is kept nice and even throughout the tooth structure. And at that moment, I keep my molar in that same position. I try to figure out either with the composite instrument or just by holding the mylar in place with medium or high pressure, depending on each case. I'll have my dental assistant light cure from the facial. So in this way, I don't have, my hands are not moving anywhere. I'm making sure that I've secured the mylar in the right position. What you're seeing right here is immediately after that light curing of that first layer, that A2B2 dentin layer, which is probably only half of a millimeter thick, because I'm only trying to restore at this point the lingual half of the tooth. Immediately after that, what comes next? In this particular case, because the patient is a young patient, early 20s, and he had a nice halo on the incisal third of tooth number 8 that we wanted to reproduce. I'm sorry, on tooth number 9 that we wanted to reproduce on tooth number 8. You've seen that I've placed a very thin layer of a white flowable opaque composite, also made by Colteen, and it's included in their Mirrors 2 restorative kit. And I like this white opaque resin because it's flowable, very easy to apply. All I do is I just put a little bit on a bib, and then I grab a 10 endo file. And with that 10 endo file, you can see that I've just painted a little bit of that white right on the incisal edge. And again, the idea is that when I place my final dentin or facial layer, a little bit of the translucency that this composite would allow to see through is going to show a little bit of that white, recreating the natural halo that the patient actually had in his teeth. And I'll show you what that means towards the end of this case. But immediately after you place that white opaque layer, please keep in mind that you have to cure that layer twice the time instead of 15 seconds, 30 seconds, because it's a more opaque composite, so that it takes a little bit more power for the light to go through it and make sure that it's polymerized correctly. And then my final tip for you today will be that applying that final layer. So now we have that lingual layer, we have that little opaque, very thin characterization that we created on that incisal third, and all you have to do now is place your final enamel layer. In this particular case, I'm still using Brilliant Everglow A2D2, which actually is used to restore dentin. But again, because this restoration was going to be no thicker than 1 to 1.5 millimeters, that thickness of this same dentin shade is going to give you a little bit of translucency, mimicking the translucency of natural enamel. That's why this is so simplified. If you think about it, I've only used one single dentin shade, a dual shade composite A2B2, which is Brilliant Everglow, and all I did was add a little bit of that intensifier, that white opaque intensifier in that incisal third. For what reason? I'll show you towards the end of the case what this looks like. But for now, once you place that final layer, make sure that you thin it out nicely and smoothly, initially with the composite instrument. And then what I do is I use an artistic brush, an artist brush. And with that artist brush that I barely wet, it's a nice and flat, very small. It's not that wide. It's maybe 5 millimeters to 6 millimeter wide. From mesial to distal, if you want to call it that way, this artist brush. And with a little bit of adhesive, all I do is just kind of brush my composite to smooth it out, make sure that I'm removing any bubbles. I'm stretching that composite down towards the incisal edge. Any excess, I'm going to section that excess with the composite instrument, remove it all. And then once I like what I see, and as you can see, you can barely tell that the composite is there. It's very nice and smooth, very nice and even very little finishing that is going to be needed after I'm done with this layer. And literally it takes me, this is now the completed restoration. You can see that I removed the rubber dam. Very, very little effort for me to go from the previous photo to this photo. All I'm using is just finishing disc. I don't go through all the finishing disc. I only use the coarse and the medium disc. You can use any brand you like. I like using Softflex from 3M, and I only use the red and the orange, which is the red is the coarse, the orange is the medium disc. And then after that, I moved back to a product made by Colteen called Shape Guard. And these are extremely, extremely good polishing silicone wheels that create this super high luster. And they come in two colors. The first one is the pink one, the second one is the blue one. The pink one doesn't create too much of a shiny surface, but it gives you a very nice and smooth surface. That is your step number one. And I use it at very low RPM. I would say between 200 to 400 RPM. Slow speed. It's a latch type of connector. And with underwater, slowly I go about putting that first pink finishing silicone wheel just to kind of get very nice and smooth surface. Once I do that, once I like the smoothness that I've been able to accomplish, then I go to the final step. It's only a two-step polishing system. The final step is now a blue wheel. It's made out of the same material. It's much finer, has diamond impregnated, and you can see you're going to achieve extremely high luster, high shine after you use that second wheel. And that's what you're seeing right here. Now, I want you to see this photo was taken immediately after the removal of the rubber dam. You can see a little bit of the white opaque that we were able to establish in the incisal edge to mimic what you can see on the incisal edge of tooth number 9. A little bit of the gray areas on the distal, the mesial, and between the mamelons, just like you're seeing on tooth number 9. And again, imperceptible transition line between the tooth and the composite interface, thanks to two things. Number one, to the infinite bevel, and number two, to our polishing sequence. Again, it's only a 4-step polishing sequence: coarse, medium, disc from Softflex or any other company that you like using, and then please the shape guard, pink and blue from Colteen. And this is literally my final photo. I want to thank everybody that joined us tonight for this case review. And if you have any questions or comments, please make sure that you write them down in our YouTube channel. And I hope to see you in our next presentation soon.